Hi, I'm Dave Casey, founder of the Innovation Leaders Club. In this video, we'll be looking at how it is important to develop empathy when it comes to developing innovation. Empathy means really to feel what your users is going through. So you put yourself into your customer's shoes. So there's different way of doing it. One way, which is more traditional, which is called ethnography, which means it's going on site and watching the users and being in their environment. But there's some other ways also that you really can feel empathy by doing it yourself. Let's say if you're developing something for teachers with teenagers, for instance, that you might go into a real class with high school girls and boys and ultimately teach yourself using tools that is already existing, then you're really going to feel the empathy of someone who's doing it on a daily basis. Or if you're developing something like a service that is for let's say for youth or for elderly people, like try it yourself. It's surprising how people haven't tried some of the innovation that they have developed in the past and tried it in the real environment. I'm not talking about trying in the lab and make it, but really trying it in the real environment with the real users. And that's one way of developing empathy. So there's nothing like going on site to get this empathy. You can watch videos, you can read survey, you can make a web interview, but it will never replace being on site. So let's have a look at the case with G. So it's a famous case, and it's clearly demonstrated how powerful it is to be on site.
This video from the Innovation Leaders Club will explain why developing empathy is a key skill in innovation through an example from a GE Healthcare case study. Listening to your customers is often repeated by innovation professionals as a critical approach to gaining insights. However, sometimes the voice of customers is not enough. Developing empathy is really what matters, so that you can understand the feelings of the user who is not necessarily the customer. This case study on GE Healthcare is a great example. We have developed a 60-page visual guidebook on how to develop an innovation strategy. It is a fully illustrated step-by-step guide to building the foundation of an innovation system. Click the link in the description below to download it for free. Instead of falling in love with your design, fall in love with your customers' problems. Doug Dietz, an industrial designer for GE Healthcare, an $18 billion division of one of the largest companies worldwide, was assigned to develop the program of magnetic resonance imaging, or MRI, systems. You can learn more about this human-centered design breakthrough with this video. This is a good example of excellent innovation. We've also summarized some of the key messages for you. Doug Dietz visited a hospital to witness and discuss an MRI installation. He chose to talk with the technician about the machine's performance. Because the technician's feedback was completely positive, Doug went on to congratulate himself for a job well done. The technician informed him that a patient needed a scan, and Doug went with him. The patient, a young girl, was anxious and fearful about her scan. To his surprise, the technician called for an anesthesiologist. But why? If there was nothing wrong with the MRI, why would the young patient need to be anesthetized? The technician informed Doug that 70% of pediatric patients needed sedatives for their scans. It was so bad that some appointments even needed to be rescheduled, forcing them to repeat the MRI setup all over again. Doug crouched down to look at the scan room from a child's perspective. He realized it looked like a slaughterhouse, cold and uninviting, with a menacing yellow arrow on the floor. He put himself in a child's shoes, the most vulnerable patient. He was able to witness the anxiety and outright fear that many children experienced when using this machine, and it triggered a crisis for him. It pushed him to find a way to make the machine more comfortable and inviting for future children. Doug went back to GE's management and tried to justify a project to make the MRI less scary. It was not accepted due to a lack of financial justification. He still wanted to change how the kids perceived the MRI. He wanted to solve the problem of children needing sedatives every time they used this machine. So in his spare time, he got various health professionals together to help him brainstorm low-cost foam prototypes for potential solutions. The solution had nothing to do with MRI technologies, but rather how the machine was presented.
Haha, on purpose, I'm cutting this video here because you're about to see the results of what Doug did with his team. And what is interesting about Doug's experience is first, he did it on his own time. So he overpassed his responsibility, which is really developing physical products. He ultimately really cared about their overall experience, even though GE was not involved into the overall experience per se, were really selling products. He really worked to develop this overall experience. So let's have a look.
With collaborators, Doug was able to come up with a whole suite of graphics to dress the MRI, costumes for the medical staff, and a story to be read for the child during his or her scan. By doing this, he was preparing the children for an adventure. One of the MRI designs he came up with was a pirate ship, and it had a story to match. The parents would read to their child about taking their pirate ship to find a treasure island. In the story, the boat would be attacked by pirates, so the child shouldn't move, and if they did, the pirates might find them. If they stayed perfectly still, they'd be safe in the boat. Afterward, they'd find the treasure and get a surprise. Doug was able to turn something scary into a creative adventure. What should you remember from this case study, and how can you put it into practice?
I hope you found this video useful. As you notice in the introduction, there's nothing like being on site to get this empathy before developing an innovation. So being in customer shoot, it is like watching the customer in this real environment. But if it's possible to really go through what your customers and users are going through, you have to keep in mind that sometimes there's a difference between who's the customer and who's the user. In the case of the MRI, for instance, there's who's buying the equipment, but also it's who's operating the equipment, and ultimately the user is the little girl that we spoke about earlier. So you see the different layers of empathy that we should have, and there's nothing like being on site. Developing with empathy, you're really developing differently. You're developing with having kind of a mission in mind, and it really increases the motivation for innovation. So let's see you in another video.
If you haven't already done so, you can get your hands on our popular 60-page visual guidebook for free. Click the link in the description below. Don't hesitate to watch the next video to learn even more about innovation management practices.